think one of the most important things that we've learned in delivering care is that you had asked, what do we measure? What can we measure that other folks aren't measuring? Exceptional care is not just about experience. There are operational things that we can do that we learn using things like Tableau, using this real-time data that lets us create exceptional care and scale that to a degree that we could never do if it was just based on experience alone. Telling somebody that they're not as good as this other hospital down the road is nowhere near as valuable as saying, if you want to be like that, do these 3 things. And that's really what Tableau has allowed us to do. And looking at 98 hospitals, looking at 30,000 procedures per year, what's the same by surgeon, by procedure, by nurse type, and how can we leverage that to deliver better care? There are core behaviors that, not just behaviors, but I would say there are core disciplines that people put in place in their lives that are just kind of how they exist, that actually result in a whole bunch of downstream endpoints. And what we've been able to do with Tableau that I've never seen anybody do with any other mechanism is to find out what are those core disciplines, those core behaviors that don't drive one performance metric, they drive 30 performance metrics. The ability for us to interact with the data the way that we wanted was completely transformational. To be able to look beyond what the standards are, to be able to dig down not to the level of what we're looking at, but kind of the things that are causing what we're looking at. That's unique, and that's not something that we were able to do before Tableau came along. The difference between the way that we looked at the information before and now, if I look at my ability to ask and answer a question and the distance between that ask and that answer now versus before, just in the last 3 years of our using the product, yeah, I've saved years of my life waiting for information.